Early symptoms of autism. Autism spectrum disorder, ASD, is a developmental condition characterized by differences in social communication and behavior. Although autism can vary widely from person to person, some early signs may include social communication and interaction limited, eye contact, and facial expressions. Children may make less eye contact or show fewer facial expressions when interacting with others. Reduced social engagement, atypical responses to social interactions, such as not smiling in response to a caregiver's smile, or not seeking comfort when upset. Challenges with joint attention, difficulty in sharing focus on objects or events with another person. For example, not following a caregiver's pointing gesture to look at something interesting. Language and communication delays, delayed speech or non-verbal communication. Some children might not babble or speak at the expected developmental milestones. They might also rely heavily on gestures rather than words. Difficulty with reciprocal conversation. Even when speech develops, engaging in back-and-forth conversation or understanding social cues can be challenging. Repetitive behaviors and restricted interests. Repetitive movements or behaviors. This might include hand flapping, rocking, or other repeated movements. Strong preference for routine. Changes in routine or environment may lead to significant distress. Focused interests. A child might show an intense interest in a specific topic or activity, sometimes to the exclusion of other interests. Sensory sensitivities. Over or under reactivity to sensory input. Children may be unusually sensitive to sounds, textures, lights, or other sensory stimuli, or they might seem indifferent to pain or temperature. It's important to note that not all children with autism will display every symptom, and the severity of symptoms can vary widely. Early diagnosis and intervention can be crucial in providing support tailored to the child's needs. Can autism be avoided? Current scientific understanding. No known prevention. At present, there is no evidence to suggest that autism can be prevented. Autism is believed to have complex genetic and environmental influences, but the exact causes remain under study. Genetic factors. Research indicates that genetics play a significant role in the likelihood of developing autism. Certain genetic variations may increase susceptibility, though no single autism gene has been identified. Environmental factors. Some studies have explored links between environmental exposures during pregnancy, such as certain infections or medications, and autism, but these factors do not cause autism in a straightforward way. Many of these findings remain inconclusive, and there is no clear, modifiable environmental risk factor known to prevent autism. Developmental variation. Autism is increasingly understood as a difference in neurodevelopment rather than a disease. Many advocates and professionals emphasize that autism is a part of human diversity, and efforts are focused on supporting individuals rather than preventing their neurology. The importance of early support. Since there is no known method to avoid or prevent autism, early identification of developmental differences is key. Early intervention can help enhance communication and social skills, provide strategies for managing sensory sensitivities, support families in understanding and addressing their child's unique needs. Healthcare providers, early childhood educators, and specialists in developmental disorders can work together to offer assessments and, if needed, early intervention. Programs tailored to each child's strengths and challenges. Final thoughts. While research continues to explore the underlying causes of autism, current evidence does not support the idea that autism can be prevented. Instead, efforts are best directed towards early identification, intervention, and support to help autistic individuals lead fulfilling lives. If you have concerns about your child's development, it is important to consult with a healthcare provider who can offer guidance and, if appropriate, refer you to specialists for further evaluation. Have you noticed your child behave like having an autism? Comment down below. Does your baby avoid eye contact or respond to their name? These could be early signs of autism. If you've noticed these symptoms, comment below. Let's raise awareness together. Like this video if you found it helpful, and subscribe for more parenting guides.